All right. Well, welcome back to our second panel today. This is on smart health cards and what a trust federation is all about. I'm Brian Anderson. I am MITRE's chief digital health physician and one of the co-founders of the Vaccination Credential Initiative. I'm joined today by an august panel group of technical wizards and experts in this space who have really helped bend the engine behind smart health cards and what a trust registry or trust framework is all about. We're excited to have Dr. Josh Mandel, Dr. J.P. Pollock, Dr. Ricky Bloomfield, and Dr. Nalini Karapanini. I'll ask each of our panelists to introduce themselves as we go through the questions, and let's go ahead and get right to it. The first question, Dr. Mandel. So Microsoft and you in particular have been working a lot in the space of health cards and smart technology. And I'm aware that your work in particular on smart health cards really started before the pandemic even began. Tell us a little bit about the genesis story of smart health cards and how you've contributed to its development.
Sure. So I'm a physician and a software engineer, and really I see kind of a through line between the work we're doing today on health cards and the work that motivated me back when I was still a medical student to go into the medical informatics field. And that was really all about making sure that the right people could get access to the right data at the right time. And as a medical student, I was very interested in making sure that clinical data could surface inside of the right workflows. And then as a patient and healthcare consumer, I became very interested in this question of how can we leverage that same technology to give individuals a copy of their own records. So the work that I started doing as part of the Smart Health IT project back when I was at Boston Children's Hospital and Harvard Medical School working on this from the research perspective was really all about APIs. How do we think about defining the right data models and the right authorization structures to give individuals a way to share their own data or to share data that they had a right to see with the apps that they chose, so that they could feed those data into an app that might help them manage their records or might help them use their data to seek a second opinion or better understand their care. And that really led to my working very closely with the international standards community, with HL7 on the Smart on Fire standards. And those standards provide consumer access. They provide a way to plug an application into any certified health record system. And that's been a big part of the national push for consumer access, for patient access to health records. Those are APIs that anybody can use under our current certification program. And there's hundreds of different electronic health record vendors that tend to be the systems that manage those individual records. And they're all part of this certification program. So that's all been playing out since 2015, 2016. These APIs have started to become more and more widely available. And then starting maybe the year before the pandemic, so starting in 2019, my team at Microsoft was asking the question, now that we've got access to these data, what's next? How do we make them more usable downstream? And one of the key challenges there was around identity and trust. So I can get a copy of my data and store it on my own device, but what if I want to share it downstream? What if I want to show it to others and make sure that they understand the chain of provenance and they understand that the data haven't been altered or tampered with? What are the new capabilities we need to layer onto that system? And that's the work that has really gone into the Smart Health Cards framework, bringing together a community to help answer those questions and provide technical standards so that not only can I see and access my records, but I can save and share them downstream in a safe way that's driven by interoperable standards. And along the way, it's been really a fascinating opportunity to work not just with the health record vendors that have been kind of the bread and butter of my previous interoperability experience, but to work with a broader community that includes labs and public health and immunization information systems. And it really has taken all of those participants to build out this kind of system.
That's great, Josh. I'm going to next turn to Dr. J.P. Pollock. J.P., so you're the chief architect of the Commons Project, and you really played a seminal role in seeing the adoption and growth of smart health cards that Josh just described, but also helping to build a broader framework of issuers and verifiers, this concept of a trust framework. Can you share a little bit more about how you've done that? What does it mean to be part of a trust framework between issuers and verifiers, and why is that important to what smart health cards is all about?
Yeah, thanks, Brian. So, just tag a little bit of stuff on Josh's origin story there. So, we at the Commons Project have been working on empowering people with health information, right? And for all the reasons that Josh describes, the best way to go about doing that is to leverage open standards and the data access that we hope that all people are granted wherever they might live or wherever they might receive care. We started this with Common Health, which is a personal health records application, much like what Ricky will be talking about in Apple Health, but on the Android platform. And during the pandemic, we were engaging in work in the East Africa community to help truck drivers and other individuals trying to deliver goods and services between landlocked countries throughout the East Africa community who required test results to get across the border. And these test results were difficult to trust. So at the border, you would get a test and you would be stuck at the border for sometimes 2 or 3 days waiting for your PCR test to come. So we worked on a technical solution to this problem that involved people getting tested at a particular lab and bringing their results with them digitally to the border so that they were able to cross. But it became clear that this was not going to be scalable and that federating that model of trust globally was going to be much, much more challenging. Around this time, we were turned on to the work that Josh was doing. Because that work was leveraging a handful of existing open standards, it fit very well with the model that we were already using for consumer access to data. So we certainly jumped at that opportunity to collaborate, with Josh, who's done so much for data access and interoperability with Smart on Fire and the like, with Ricky and the Apple team, who really spearheaded so much of the direct patient access that we have from health systems today with their work on Apple Health. And as the need for VCI became clear, with you folks at MITRE, thanks to the role that you've been playing in the development of the FHIR standards along the way. So, where this netted us out was beginning to understand how smart health cards work and the beauty of the open framework, meaning that anyone can create one. There's ample flexibility for lots of different kinds of organizations to develop these, which was really key in getting this up and off the ground in the US with our fragmented ecosystem. But it also led to a lot of challenges, right? We need to think about which of those many, many potential issuers can be trusted to issue smart health cards and which of those issuers can be trusted in different sorts of circumstances. So this is where a trust framework can help. Trust framework in its simplest terms is really just a list of issuers along with associated metadata who we feel and the community feel are trustworthy. And ultimately, people can consume a trust framework in different ways. They can make their own choices about which particular issues they may trust in different circumstances. And it's our role to convey, this is a particular set of issuers. Here's the information that we understand about these issuers, and here are the requirements to become one, and the processes that we follow to ensure that they meet those requirements. So we operate alongside the VCI community and steer code, the VCI directory, and also the Common Trust Network. The VCI directory is effectively all of the smart health cards issuers that are in this Common Trust Network. The policy for that directory is set by the group of VCI steer co members with pretty broad community input, I would say. And we have a particular set of issuers that we have decided to admit at this point to keep things limited, understandable, and really in a good place for all of us to trust the list that we have. So, because this is so new, right, this list includes things like pharmacies that are offering vaccinations and lab testing, the labs that perform those tests, clinicians who are providing care, the insurers who are paying for those services, and the public health departments that keep the communities that we live in safe. So how does this work? The VCI directory is open and available to everyone. It's effectively a JSON file with some technical checks and things that go along with it. The Commons Project Foundation offers APIs and verification services around that directory for folks who are interested in that level of service. But if you're looking to verify smart health cards, there are several places that you can start and leverage these trust tools, including free verifier applications like the one that we produce, known as the Smart Health Card Verifier application, as well as the scanner app that New York State has produced and others.
Great. Well, thanks, JP. And I know that when you're dealing with the currency of trust, it's important to be open and transparent about everything that we're doing. And I know that you and the VCI team have been doing a great job at helping to ensure that all that process is open and transparent for the VCI issuer directory and the Common Trust Network. Speaking of openness, so Nalima, so MITRE's role really has been foundational to the building of that open source technology and the standards that go behind it.
Great.
Share a little bit about your role, MITRE's role in helping to pull all this together with HL7, the standards body, and where exactly we're at with the maturation of this as a standard within HL7.
Yeah, absolutely. Thank you, Brian. MITRE as an organization has built extensive expertise in open source development tools and reference implementations to help prove, advance, and disseminate new technologies. That is aligned with our mission as a nonprofit that runs federally funded research and development centers for the public good. And we've built sort of particular expertise in the healthcare area in standards-based open source development and testing tools. So I think that's what our role has been within VCI. We have an open repository and GitHub under DVCI with some offerings under the Apache 2.0 license. One of those is a health cards Ruby library, which is kind of a multi-purpose reference implementation for both issuing health cards and verifying them. We've been working in conjunction with ARA, the American Immunization Registry Association, on an issuer reference implementation that they'll include as part of their interoperability toolbox, which will allow issuers to kind of kick the tires on generating smart health cards from their existing IIS data services. We're sort of pivoting more now that more and more people are able to get their hands on their smart health cards. We are pivoting to supporting verifiers, including small businesses who might want to use these cards to safely serve their communities. So under that, we are planning to soon, fingers crossed, release a web-based verifier offering, which will exist, alongside the existing mobile offerings. And for those who are interested in doing a technical deep dive into the specification, we have a health cards code walkthrough in the form of a Jupyter notebook. And on a sort of related side note, I think you'll hear later in this forum about the great work California has been doing to open source their issuer application. And MITRE has been lending our open source experience to hopefully get that deployed and up and running in other interested non-West Coast sunny regions. As mentioned, there's also the standard side of things. And to that, we are working with HL7 International to get our implementation guide sort of formally incorporated as part of their standards. HL7, for those not in healthcare, is probably, I think, the largest not-for-profit standards development organization in the healthcare space. And bringing our data model under their purview kind of injects a healthy degree of process and governance to maintaining that data model long-term. So we just went through our first ballot process with the Public Health Working Group, and we did achieve the threshold of positive votes to be able to, within the next couple of months, put out a formal release. Right now, we're going through the reconciliation to address any of the issues or concerns that came up during that ballot process. And all of those meetings are completely open to the public. HL7 operates in a very transparent manner, and we'd love to get community input on any of these issues that have come up. And in particular, we'd like feedback on some of the terminology and vocabulary questions from stakeholders in the international and cross-border use cases. This has kind of proven to be stickier than we thought it would be. We'd love to hear more from lab issuers and verifiers. I think that use case has kind of taken a backseat to vaccine verification a little bit, but it is an important part of the public health toolbox, and we'd like to provide more support and experience in that area. And of course, we'd love community input and contributions to our open source repositories. We welcome feedback and suggestions for future enhancements there. So that is my plea. I'll turn it back to you, Brian.
Well, it's great, Nalima, to hear you just describe how this whole community is coming together around empowering public health authorities, empowering states like those in California leading the way, New York. I know that probably many of us are aware of the governor's announcement around the blueprint that they published, really about how do you take this kind of technology, these kinds of standards-based efforts to empower public health authorities, certainly for this pandemic, but beyond, and what does that look like? And so with that in mind, I want to turn to Dr. Ricky Blumenfield. So Ricky, at Apple, you've developed this wonderful interface between smart health cards and one's digital wallet. I'd love if you could perhaps maybe walk us through what that looks like, what that feels like with the new release of iOS 15.1. But also, I'm super curious, your perspective, where are smart health cards going from here? So we're starting with vaccination credentials, but fundamentally we're about empowering individuals and empowering public health authorities, but individuals have verifiable copies of their health data. Of course, right now it's with vaccination records. Where is it going from here? But maybe a demo first, Ricky.
Great. Yeah, happy to jump into that. I think a demo can often speak 1,000 words. First, I would be remiss if I didn't just thank the other panelists here and point out and reemphasize a point that I think Rebecca Coyle made in the last session as well, which is all of this only works through deep collaboration across the entire ecosystem. Those developing the standards, those implementing across platforms, as you heard on the Android side, as well as the iOS side, or those who don't have any device at all. We need to make sure that these the technologies and capabilities are available to as many people as possible, because healthcare doesn't discriminate in terms of who can get sick, who needs to be vaccinated, and who needs access to their information. So we really need to make it as broad as possible. And at Apple, that's been core to our mission to make this, to build what we're doing on open standards, so that nothing here is proprietary to Apple, but also works across platforms, and to do it securely and privately. So I'll go ahead and share my screen. All right, so this is my phone running iOS 15.1. And as Brian mentioned, we added support for the ability to bring in smart health cards, no matter what the source is. We now have many states are supporting this, many provinces and territories in Canada and other countries around the world. And so I'll bring up one of these example QR codes. I'm not showing you any real patient data right now. And of course, this QR code could be scanned. It could be printed if you don't have a smartphone. And if you're accessing this on a smartphone, for example, in California's portal, you might see a button, for example, add to Apple Wallet and Health. In this case, I'll go ahead and tap that button. And when that happens, you can see that this is automatically recognized, and there is a preview of the information that you can see before you add this to your phone. Of course, you want to make sure you're adding the right information, and all of this throughout is in the user's control every step of the way. I'm going to tap Add to Wallet and Health, and that information has then been added to your wallet as well as to the Health app. And so when I click Done, you're dropped into the Health app where you can see this information is available. You can see the same QR code, a preview of this information. And when I tap on View in Wallet, you can see that this information is brought up right in the wallet in a simple and easy to access pass. This vaccination card is also available on your lock screen. But one of the things that's so important to us is that the user maintains privacy throughout. And so when you want to bring this up on your lock screen, right now I'm actually covering up the Face ID of the phone so it can't authenticate. And you can actually see here that the information on the vaccination card is not visible unless you're actually logged into your phone. And so I'm going to uncover Face ID and go ahead and tap Try Again, and you can see that the data is then made available right away. And then the last piece here is we recognize that once users have this on their phone, they might want to share it with other apps that they trust. And again, that's something we wanted to put into their hands so that they control who has access to this information. And so here we have a sample app made available to developers where they can see how to implement this API. United Airlines just implemented this a few weeks ago. And so when this app wants to request access to the data, this is what the user would see. They can then tap on the record they would like to share, and then tap Share Once, and then that record is shared. And again, all this is in their control. No data leaves the phone without their express permission. And so I'll go ahead and stop sharing my screen. And so the question was, where do we see this going in the future? And I think this speaks to the power of the platform. And we had built in capabilities prior to smart health cards to let users access their health information, as JP mentioned. We started out in 2018 with 13 health systems and 3 EHR vendors. Great early partnerships there. And this was before a federal requirement to make available FHIR APIs, FHIR-based APIs. And that has since grown from the 13 and 3 to over 700 health systems and clinics across the country, representing over 12,000 locations, as well as 12, from the 3 went up to 12 EHR vendors, lab vendors, as well as custom implementations such as the VA, who of course have their own infrastructure there. And this all speaks to the power of not what Apple has done specifically, but we wouldn't have been able to do what we did without aligning on a common standard in the entire ecosystem. And that's the real power of what's available here. And so today, through the FHIR API, users can access not only their immunization records, but their labs, their vital signs, medications, procedures, conditions, et cetera. And so you could see a world in the future where this flexible smart health cards format could be used for other data types. So right now it's used for COVID immunizations and COVID test results. I could envision that it could be used for other vaccination types in the future, so that parents could get access to their children's information, easily share it with schools, as they have been required to do for decades now. And you can imagine other health data that could be made available. That's one of the reasons that building on a common set of standards really makes this work, because the FHIR data model is flexible enough to support any data type, not just immunizations or test results. And so it'll be exciting to see what the broader ecosystem does and how they come together to make this possible in the future.
That's great, Ricky. And so, given this runway of potential, it's obviously important that we get this right as a community. To your point, Ricky, the deep kind of collaboration that is requires thoughtful consideration on what some of those next steps are. How do we build consensus? I'm curious, so I'm going to open this question up to the group. Given the importance of smart health cards and the rapid adoption that we're seeing, it's essentially becoming the de facto standard here in the United States and growing internationally, with over, I think, 150 million Americans able to access smart health cards in all 50 states. I'm curious, just to the group, who or what are the policy or technical things that are still in the way that we really need to address or come to consensus around to take this, in that direction that Ricky just articulated, the next step of what smart health cards could be?
So I can say, Brian, from my perspective, the core technical issues are not especially deep or challenging. I mean, they're very important to get right, and they are highly detail-oriented. And we've been through rounds of testing and review, and sometimes even small changes can have an impact that's hard to anticipate. So it's very important to have that community together around decision making. But the technical details themselves are not that challenging. And I think we've seen many different systems pop up around the world that solve a similar set of problems with sort of similar or in some ways equivalent technologies, slightly different design choices. But the hardest challenge here is really getting alignment around adoption. And here is where I think smart health cards has maybe the strongest story, because not only do we have a specification that's based on these open cryptography standards and open standards for signing data, but we also leverage FHIR. We leverage a set of healthcare data APIs under the hood so that the framework we've built can support not only the pressing health data needs of the pandemic with COVID vaccine results and COVID PCR tests, but can grow to expand to support other use cases within the clinical domain. We've thought about these standards as supporting access to any vaccine record for sending a kid back to school, or for traveling in worlds where there's in regions where there's endemic disease where vaccines are required. So I think that's really the strong point, and growing consensus around those open standards for me is the key.
That's great. Great point. I want to raise that we just have a few seconds left. There are a ton of questions in the Q&A. There's over 18 that haven't been answered. I'm going to commit to those that have asked questions, that those on the panel, we will all work with our technical producers to ensure that we get you answers to those questions. There's one that I can answer right off the bat, the open source verifier app. We will make that freely available. That will include business logic that will allow states and other public health authorities to determine who's vaccinated and who's not. And we will obviously grow to be able to hopefully accept testing results as well. But there are a bunch more in there that we want to be sure that we answer in time, and we'll get back to you on that. I know that we're at time. And so what I'd like to do is, all of those of you that are joining, there is the next session, go into the lobby, click on that one, the next panel, to join that group. And we thank you for joining, and we'll see you guys later.